Let's begin here. Rahima Moosa Mother and Child Hospital has lifted the suspension of Johannesburg pediatrician Dr Tim Maayer. He was placed on precautionary suspension after publicly speaking out against the state of the healthcare at the facility. Gauteng MEC for Health Dr Nomathemba Mokgethi intervened to ensure Maayer returns to work. He penned an open letter on the 24th of May detailing the challenges public hospitals in the province are facing. He is a pediatric gastroenterologist who works in public health care. His open letter highlighted major challenges faced by Gauteng's public hospitals. The provincial health department is burdened by budget constraints, poor facilities and high patient volumes. His suspension saw outrage from the medical fraternity. And let's stay with this particular story and speak to Professor Adam Mahomed, Maxeke, head of internal medicine. Thank you so much for your time, Prof. I mean, should he have been suspended to begin with?
Thank you, Bongiwe, for having me on your show and to your listeners, and to highlight this tragedy of events for Dr. Tim Maayer and for the healthcare system in Southern Gauteng. He should never ever have been suspended. This should not even be a topic of discussion. We have now deflected away from the crisis of the poor management of the hospital, the poor resources and the poor care we're giving, because management has done an injustice by suspending someone for no reason except for being honest, fair and just. So I totally agree with you that this is such a shocking state of affairs that we are in currently.
Especially when you read his open letter, he says that he has raised this issue internally before he's done what he needed to do. And this appears to now be a cry for help to get the attention of the provincial department. Did the suspension, would you say, further perpetuates the culture of fear among doctors in order to not speak out against some of the challenges they're facing?
I think what we have to admire from Dr. Tim Maayer is his courage and conviction for what he's done, and he's willing to put his neck out. And you're 100% right. What has happened is going to stifle voices to the benefit of community and society at large. We must speak up against injustice, whether it's against our employer or not. And he did not do anything wrong. He did the right things, he highlighted things. And it's just not about the Department of Health. He's highlighting water issues, sanitation issues, electricity issues, things that anyone should take for granted, that a hospital is a safe place to have running water, uninterrupted electricity supply, safe consumables, safe personal protection equipment for whatever disease. This is what he's highlighting. So he's not highlighting tertiary care and amazing, high, expensive care. He's highlighting basic care. The state of toilets in a government facility. That's what he's doing. And what does he get? He gets suspended and treated like a common criminal.
And he also further, for example, to add to the examples you've painted, talks about how the hospital should be exempt from rolling blackouts because the generators are inadequately sized to assist, and as a result he's watching children die, and this is something that is so difficult for him to even fathom as a pediatrician. Like, one can only imagine what it's doing to him. Does this signal to the poor management at this particular hospital?
I think this hospital is a reflection of almost all the hospitals in Southern Gauteng. Maybe people are not being honest, but it's a true reflection of the state of healthcare at every single institution. We are not being honest with the public. Managers, CEOs, your responsibility is directly to your healthcare workers and your patients, and then only to your boss above you to make sure the budgets are getting done properly. We talk about budgetary cuts. It's not budgetary cuts. It's the dishonesty and thuggery and stealing of resources that's crippling our healthcare. And our managers need to be honest and support us in what we're doing. He spoke and he was honest. And now it took 24 hours of a lot of noise for the MEC to get involved. The MEC should never have allowed this. And I'm going to ask another question to the public at large. What about the repercussions for how we have made this doctor feel? Who gets away with that? What was the justification for doing this? This is now going to be brushed underneath the carpet and we'll carry on with more disasters next week. There's no accountability. The CT scan at that hospital is condemned and not working and is unsafe. Yet, nothing is happening. From the same MEC, the Premier, everyone knows of our plight in healthcare. And Tim Maayer had took the courage to pen it in a writing and to highlight the most vulnerable patients, children, are dying. Can you imagine if our previous President Mandela was here? The love of his children for children was unsurmountable, yet we're killing them. Yes, we are. Malnutrition, bread issues, it just doesn't stop. I'm sorry, Bonge, it's a never-ending story of disaster. And no one to date is held accountable except for those at the bottom level. He's a frontline worker and you're suspending someone who does day-to-day working. What about its impact on his fellow workers and patients? Nobody thought about that, but let's just suspend someone and tell him to be off the premises like a criminal, take your valuables. That's the level of degree that a letter was sent to him. It's embarrassing and shocking for healthcare workers, and I want to raise an alarm. This might be the start of more abuse of healthcare workers if we don't stand up and fight for justice as a country, especially in healthcare.
You allude to the letter. Did you get to see the letter that was sent to him of suspension? What did it say, if you're able to share with us?
He has to be off the premises on the 9th of June. He must take all his valuables and not be on site to that degree. And why? One of the reasons for his suspension, because he had conduct unbecoming. He did not conduct himself in an appropriate manner. What irony is that the one doctor who's conducting himself above board with pure conscience to the benefit of society at large. Other people are calling him unprofessional and unbecoming conduct because he went to speak to the media after all his calls, not only of him, of his entire professors. Numerous professors has highlighted the issue at Rahima Moosa and other hospitals. But no one's listening. We have a Gauteng department which is deaf, which is not hearing the plight of patients and us. You have issues of cancer, you have issues of long waiting times. We have a shocking state of ambulances in Gauteng. But we're not going forwards. After 30 years, we're going backwards. Prof, something has to change.
Pardon me for coming in there. What does it do to the mental well-being of the healthcare workers like yourselves? If you had to deal with the pandemic, now you have to deal with all these challenges. I mean, when you think about there be at Rahima Moosa, for example, one toilet that has to be shared by the fathers of the children who are, whose mothers have just given birth. The rest of the toilets are left for women. Things like those, broken toilet seats. What does it do to the mental state of the healthcare workers working in these institutions?
I think there is probably the majority of healthcare workers, and not just healthcare workers. We're talking about general assistants. We're talking about the administrative staff. All of them deal with the hardship of patients when they come and complain about what's happening. And the morale is so low. But the love of the Gauteng healthcare workers, I think even for the country, is what's keeping the healthcare system afloat. Not the managers, not any politician. The healthcare system is just staying above water because of the love and commitment of healthcare workers and auxiliary staff. That's what's keeping us going. But we're at the end of our rope, and we don't have much rope left unless we have an urgent, honest, transparent intervention. And that's what I'm asking for. It's not just Gauteng. The entire country needs to have an honest, reflective look about the state of healthcare, from the young to the elderly, to cancer, tuberculosis, HIV. Everything is ringing alarm bells. We need help, but we can't be abused and be used as sacrificial lambs anymore. That has to stop. So I'm putting out this message. The nonsense must stop.
All right, Prof, thank you so much for talking to us this evening, especially amidst the cloud, as you say, that more healthcare workers need to come forward. And we will also just really continue to look closely at this particular story. And that was Professor Adam Mahomed at Charlotte Maxeke. He's the head of internal medicine. And this, of course, was around the uproar of Dr. Tim Maayer, who was suspended for writing that open letter detailing the sorry state of Rahima Moosa Mother and Child Hospital.